Hi everyone and welcome to this taster session for psychology. The point of the session is to give you a brief introduction to the courses that are available with us in psychology, what those courses will involve, so the topic areas and the skills required, whilst at the same time doing some hopefully quite fun and interesting activities. So before we get started, you're going to want to grab some paper. Some of the activities that we're going to do in this session are quite big and require written notes, so you're going to want to have enough paper to complete those activities. And also some of you may want to take some notes on what the courses involve so that you can further use that to make your own choices later on, but that's not necessary if you don't want to. All that information is available to you on the website and also in the prospectus, but I know some people like to take those notes. So pause that here and grab some paper, and then as soon as you're ready, we're going to go into our first exercise for the day. So the first activity is psychology true or false. Some of you may be sitting here and you've never really come across psychology, therefore you might not be that familiar. Others might think that they are quite familiar with some of the concepts, so let's see what you know so far. The topic area is going to be psychopathology for today's taster session, which you may know as the study of mental health issues. So how familiar are you with some of the concepts that we will cover if you come to study psychology with us at the New Collaborative Trust? So 10 statements. All you have to write on your piece of paper is whether you think they are true or false. So off we go. Statement 1. Mental health problems are quite rare, approximately 1 in 100. True or false? 2. Multiple personality disorder is a real mental illness. True or false? 3. Mental illnesses can be treated with medication. 4. Geliophobia is the fear of laughter. 5. Mental illnesses are caused by problems in childhood. 6. Mental illnesses often run in families. 7. People with schizophrenia can hear voices that aren't there. 8. Some things classed as mental illness in our country are normal in other countries. 9. Serial killers all have mental illnesses. And lastly, what is considered a mental illness can change over time. So you may just want to pause this here and run back through the 10 statements just to clarify anything you may have missed, because I went through those quite quickly. And then once you're happy, we're going to go through the answers to those statements now. Okay, so first one, mental health problems are quite rare, approximately 1 in 100. This is false. According to a recent UK survey, approximately 1 in every 6 adults will be diagnosed with a mental health problem, with some people arguing that depression and anxiety are as common as 1 in 3, unfortunately, in today's adult population. Some disorders, however, though, like schizophrenia, which we're going to talk about today, are approximately occurring in about 1 in 100 people, so they are quite rare. Statement 2. Multiple personality disorder is a real mental illness. Now that is true, it's just that it goes by a different name. So it's not called MPD anymore, it's now known as dissociative identity disorder, but it is genuine. It affects about 1% of the population and it's characterised by really long periods of amnesia. Statement 3. Mental illnesses can be treated with medication. Absolutely true. Many mental illnesses now have drugs specifically designed to treat that particular illness and reduce the specific symptoms associated. For example, if you get diagnosed with clinical depression, you may be given a drug called an antidepressant, for example, Prozac, which would treat specifically your symptoms. Statement 4. Geliophobia is the fear of laughter. Now, this is absolutely true. You can have a fear or phobia of any stimulus, and most phobias or fears come from the Greek or Latin phrases. So, gelo is Greek for laugh. 5. Mental illnesses are caused by problems in childhood. True or false? Technically, That one is not true. It is false. Some mental health issues may have some kind of relation to what the person has experienced in childhood, but that's not always the case. What we know from psychopathology research these days is that it's more often than not that mental illnesses can be attributed to our biology, such as our genetics and specific brain abnormalities, which takes us into statement 6. Mental illnesses often run in families. If it's down to our genetics, then this statement must be true. Unfortunately, if you have got a member of the family previously diagnosed with a mental health issue, you actually have an increased risk. For example, with schizophrenia, you are 6 times more likely to be diagnosed if you have a parent who has already suffered with that same disorder. 7. People with schizophrenia can hear voices that aren't there, and this is true. It is known as an auditory hallucination. Now, whilst not all patients have those symptoms, it is one of the more common. Other common hallucinations are visual hallucinations where you can see things that don't exist. Statement 8. Some things classed as mental illness in our country are normal in other countries, and this is true. And we're going to talk again about schizophrenia here. In some African tribes, to hear a voice that isn't there would be seen as a spiritual gift. Now, as we've just said in our country, if you were hearing voices, that might be a signal that you may be suffering some of the symptomology of schizophrenia. So this is true. Things that are classed as mental illness in one place aren't necessarily the same elsewhere in the globe. Serial killers all have mental illnesses. Now, this is false. This is a common myth. Though many, if not all of them, would be classed as what we would say a psychopath, that's not actually a diagnosable condition. It's not a mental illness as such. Some serial killers have been known to try and use mental health issues in order to get a lighter sentence or a reduced sentence, but we certainly wouldn't be able to claim that all serial killers have a mental illness. And lastly, statement 10, what is considered a mental illness can change over time, and this is absolutely true. So a little fact for you here. Society often changes its view of what is normal. For example, prior to the 1970s, if you were openly homosexual and seen to be engaging in homosexual behaviours, you could have been diagnosed with a mental illness and you could have been institutionalised. So give yourself a score out of 10 for that first little activity. Then you want to pop that to one side, and we're now just going to take a look at the options that are available for you should you wish to come and study psychology with us at the New Collaborative Learning Trust. So, before we begin looking at the courses, we just need a quick definition of what psychology is. Like I say, some of you might not be familiar. So we normally say that psychology is the scientific study of the human mind, brain and behaviour. Most people know that it's something to do with studying people, but what not everybody knows is that it is a science these days. So for that reason, you need to be aware of the fact that psychologists do conduct research studies. Now, some of you, depending on which course you sign up to, you will actually be conducting your own research study at certain points in your courses. So it is the study of human behaviour, looking at the brain and the mind to explain our behaviour, but doing it from a scientific point of view. So, what are the courses that we have available to us if you come to study psychology? We have 2 main courses. One is at academic A level, the other is the vocational BTEC. So we're just going to run through and compare and contrast what the difference is between these courses, and then you'll be able to use that information to make the best choice for you in the future. So the A level, first and foremost, has got entry requirements which are 5s in English language, maths and science. Now, if you compare that to the BTEC is just 1 grade lower, so you require 4s in English language, maths and science. So you can see there's a slight difference there in terms of what you need in order to be able to access these courses. The A level is all exam-based assessment, so no coursework at all. You do 3 2-hour exams at the end of 2 years. Whereas with the BTEC, there is some exam work. So you've got one rather big exam, which is 2 hours, but the other parts of the course are assessed internally using coursework. The A-level focuses more on academic psychology, so looking heavily at lots and lots of research studies, and you've got to be able to learn a lot of those details to be able to discuss them effectively in an exam scenario. Whereas the BTEC takes much more of a focus on psychology in a vocational setting. So you look at what psychologists actually do. So you look at the roles of, for example, clinical psychologists working in the real world kind of setting, okay? So more emphasis in the A-level on academic psychology and a lot of research studies, whereas with the BTEC, you're looking more at psychology from a practical vantage point, okay? So what do genuine psychologists actually do in kind of like their real life, okay? And we do that in a vocational setting rather than just putting you through a set of rigorous exams. The A-level, okay, has got 3 units in total with 11 subtopics to cover over the course of 2 years, whereas with the BTEC, you only cover 4 specific units over the course of the 2 years. So side by side, you can see what the major differences are between the A-level and the BTEC. Obviously, if you are kind of a person who likes the exams and likes revising and likes preparing in that way, then the A-level may be the better choice for you. If, for example, however, you found exams quite stressful at GCSEs and you prefer to motivate yourself by completing coursework and assignments and you can keep on top of deadlines in that sense, then maybe the BTEC might be more suited to you. It's just all about deciding kind of where you fit in terms of what you want to get out of this course and also the skills that you can bring to it. Now, just to clarify before we move on, both courses are single qualifications. So that would mean that you would have 3 lessons per week, regardless of whether you choose the A-level or the BTEC, you would see your teacher for 3 lessons per week for either of those courses. So let's just take a very quick look now at what some of the topic areas would be, okay? We're going to start with the A-level. Now, this is not all of the topic areas. As I've said, there are 11 in total, but these are some of the main things that you'll be covering. So we've got memory, looking at our memory's capabilities and why it sometimes goes wrong. So we also look at why we forget things. We look at aggression, mainly from a nature-nurture point of view. So if you are an aggressive person, is that because of your life experiences, or is there something in your biology which is predisposing you to be quite violent in your tendencies? You can see that we take quite a detailed look then at human biology, okay? We work out to what extent all human behaviour can be accountable to our biology. We look at psychopathology, which is the study of mental health issues, which is the main focus for our taster today. And specifically, we look at schizophrenia. So what are the symptoms? How do we diagnose it? What causes it? How do we treat it? And so on and so forth. Obedience tends to be an interesting concept to study. So what drives people to inflict pain and suffering on potentially guiltless groups? So some of the minority groups that were persecuted during World War II in the Holocaust, how were people getting to the point where they could inflict that pain and suffering onto them without much effect? And then at the bottom, quite important, because we are a science these days and we're classed as a science, you will be doing quite a lot of mathematical calculations, interpreting data from investigations, and so on and so forth. So you've got to be prepared to cover at least some stats and maths in the A-level. Moving over onto the BTEC, we've got 4 core areas. So you can see it's slightly less in terms of what you have to know in terms of the breadth, but these are your 4 core topics that you'll be working through. So you'll be doing approaches in psychology, which is key concepts and studies, and that is exam based. You're going to be looking at health psychology, which is also exam based, which is really looking at things like stress and addiction. You're going to be looking also at psychopathology and research methods. So whilst the first 2 key concepts are assessed by an exam, okay, the latter 2, so psychopathology and research methods, will all be report based. So this is where your coursework element comes into it. So they are the topics that you will study if you come and do the BTEC, okay? So with that in mind, then now we're going to move into the main bulk of the taster session for today. I'm going to ask you to move away from this video clip into a website called TED-Ed, and that will take you through the next few tasks. So the link that you're going to use is this one here. It can be accessed in a number of different ways for yourself. So if you click on the icon on your instruction sheet, it will take you to TED-Ed. If you click the link underneath this video, all right, on YouTube, it will take you straight in there, and you should be able to just see the link at the bottom of the document as well. So this is what you will get taken to if we click on this link. It takes you to straight into the web link for my lesson, all right, on defining abnormality here. So you can see that. The instructions are quite straightforward. So it tells you you're going to do 5 little subtasks as part of this activity. You work your way through them all individually. So you're going to watch the video. You don't need to take notes. It's really not essential. You're going to click on the think option, which is then to answer 5 simple multiple choice questions in relation to that video. Then the main bulk of the activity is to read a behavioural case study. So when you open that little task up, which is dig deeper, it'll take you to a PDF, all right? You want to read those carefully, and then based on this task here where you're going to rank them, the next thing is a discussion forum, and you're going to tell us what you think to those case studies. There is some additional information listed right at the end, okay? So you can always check this out. And then once you've worked through those 5 tasks and you've contributed to the forum, you're going to return to the original YouTube clip, okay? So you now want to switch over then to TED-Ed and work your way through those 5 tasks. I think they'll probably take you about 15 minutes, okay? Okay, so now that you've figured out a little bit about how we actually define abnormality, we're going to do one additional task here about how we actually go about diagnosing someone with a mental illness, okay? Slightly different to trying to categorize abnormal from normal. So when we say the word diagnosis, it means to identify what illness somebody is suffering from a list of their symptomology. Diagnosing mental illness is quite difficult as the symptoms can vary quite a lot, but they can also overlap, which creates confusion as it's unclear which disorder the people are suffering from. So in order to help us do that, we typically use what we call a diagnostic manual. So one of the most commonly used diagnostic manuals is the DSM-5, and that will contain all known mental health issues with all of the symptoms associated. So let's see how much you know about 4 major mental disorders at this stage. You may have heard of them already, but the 4 that we will mainly cover in psychology, both the BTEC and the A-level, are phobias, OCD, depression and schizophrenia. So this is a really nice short task. All you're going to do is going to write these disorders at the top of your piece of paper, and we have got 12 symptoms for you to try and sort your way through. So you want to pause this here, read those carefully, try and list them underneath the mental health issue that you think is being described, and then I will reveal the answers in a moment. Okay, so let's see how you got on. For OCD, you should have had 5, 7 and 11. So OCD is a preoccupation with germs, or having forgotten something. It's uncontrollable, so you can't stop the upsetting thoughts entering the person's head. And what that causes is ritualistic behaviours, so they try and get rid of their distress by performing these repetitive behaviours. Phobias, you should have had 1, 3 and 9. It is a fear associated with a particular object or situation, and consequently the person usually goes out of their way to avoid that situation or that particular stimulus. If they are presented in a situation where they can't escape, they're more than likely going to experience some intense distress. Most usually that will manifest as an anxiety attack. Depression, you should have had 6, 8, and 10. So it is the inability to experience any sort of pleasure, which will often give you a loss of interest in most daily activities. People with depression can motivate themselves to want to complete regular daily activities. And obviously, they've got feelings of worthlessness and quite intense sadness where they're unable to actually feel happy. And then lastly, we have schizophrenia, which is 2, 4, and 12. We have hallucinations, which is to sense things that aren't there. Speech, which is really confused and irregular. So the lady who was speaking in tongues on the previous exercise. And then delusions, beliefs that are completely untrue. And these are often, unfortunately, quite paranoid in nature. So again, give yourself a score out of 12 there, and we can see how you got on with that task also. So before you leave us for this taster session, I just want to pose a quick question to you. You need to just consider now whether psychology is for you. So just to refresh, we've said that it is a science, okay? Not a science which we would liken to physics or chemistry, so don't be thinking of it like that. But it does involve quite a lot of research-based work, either practically conducting that research yourself or looking at a lot of research studies and academic pieces of literature on the A level. So you want to just be familiar with that idea that it is a science. You want to kind of have an interest in studying people. Psychology is really interesting because you get to find out who you are and who the people are around you and why we are the way that we are. But then you also need to have some good core skills. So good English skills are quite important. Obviously, there are exam-based assessments on both the A-level and the BTEC. So we would expect quite clear English skills from you there. So you want good thinking skills, wanting to learn about people, knowledge that it is a science. And then the last thing that you've got to do there is just decide which of the courses do you think would be most suitable to your skill set. I hope that you've enjoyed this taster session, and I look forward to teaching some of you hopefully in the future. Take care. Bye bye.